everyone, Jillian McLaughlin, Director of Operations at Lyndon Rescue. I'm here to go over our COVID-19 policy. We might request you if we needed a lift assist or CPR in progress, and in that situation we have all the personal protective equipment that you would need to put on before you enter the scene. Each ambulance has this folder in it that contains all of our information as well as the donning and doffing checklist. You can use this with another person to go through all of the steps and make sure that you're putting it on and taking it off correctly. Pat will insert a zoomed up picture of this now. Also on each ambulance is our black infection control kit. This kit is accessible from outside of the ambulance so that you do not have to get into a potentially contaminated ambulance. The infection control kit has everything that you may need, including in the donning and doffing checklist. There are N95 masks. These masks are universal, so one size fits all. They have instructions on how to open them and how to fit them. When you're putting the N95 mask on, make sure you have a good seal. When you're sealing it to your nose, make sure you're pressing down both sides of your nose and not just with 2 fingers in the center, because you'll get a better seal if you press separately with 2 separate fingers. When you're done, you can put your hand over the mask where you would inhale air through. Inhale quickly, and if you feel air rushing in by your nose, you need to readjust the nose so air is not leaking in. We are only using the N95 mask if there is an airway procedure. So if we are doing CPR, sectioning an airway, or putting someone on CPAP. If those aren't the situation, we're using surgical masks. Surgical masks are being used for every single potential COVID-19 patient, on the patient, as well as for us unless we're using an N95. The kit has both regular masks and masks that have the face shield. You would want the one with the face shield. If you're using an N95, there are separate face shields. So the options are combination mask face shield for all potential COVID-19 patients. If an airway procedure is being done, N95 plus separate face protection. The next thing in the bag is a gown. So for every COVID-19 patient, as long as we have the proper supply, we are using gown, gloves, face protection, and mask. It changes with airway procedures, gown, gloves, face protection, and N95. And Patrick will now show you the proper donning and doffing while I read him the checklist. Remove any loose jewelry and tie back long hair. Perform hand hygiene with hand sanitizer. Apply gown if using and fasten. The gowns are universally sized, and the state sent us all 2XL, so they should fit everyone. Apply mask, surgical mask or N95 based on the situation. The surgical masks in the top have the piece that you can push down to conform to your nose. Apply eye protection. Apply exam gloves over sleeve of gown if using. You now have all the proper PPE to enter the scene. Upon exiting the scene, we'll need to remove all of your personal protective equipment. Step 1, remove glove using the inside-out method. Grab the palm of one hand, pull off inside out, and now come under the other glove to touch the clean part and pull off inside out. Dispose in the proper waste container. Perform hand hygiene. Remove eye protection. And dispose of properly. Perform hand hygiene. Remove gown. Perform hand hygiene. Remove mask. Perform hand hygiene and then wash your hands as soon as you're able to. If available, you can use the combined mask and face shield if an airway procedure is not being performed. These are pink masks that have the face shield attached to them. Don't actually put it on. The two options are face shield with attached mask, or if there are none available, you can use a regular surgical mask and add the separate eye protection. If you're using the N95, it's the same eye protection as well.
Thank you very much for watching that video on proper PPE during the COVID-19 outbreak here. If you have any questions, please reach out to one of the officers. Thanks very much, and we'll see you next time.